to have true healthcare reform and not health financing reform, we really need to help people create health. The reason for the spiraling healthcare cost is not because of irresponsible insurance companies. The healthcare costs are rising because we've got a lot of unhealthy people. To cause a clot and block. I'm currently on the board of directors of the American Academy of Private Physicians, and through this organization, I've been introduced to many innovative technologies, many innovative testings that are going to really impact my patients' lives and implement into what I now consider a third era of medicine practice. So as I'm identifying patients with disease, I would have a subset of patients who I couldn't find a cause for the problem. Well, then when I discovered the amazingly strong association between mouth disease and the things that I do treat, like blood pressure, diabetes, heart attacks and strokes, even things like pneumonia and a whole long list of systemic diseases that can originate from disease in our mouth, that was another turning point in my career.
From a disease standpoint, when we have different situations in the mouth, we respond, our body responds with inflammation, and that's where we start the inflammatory cascade that's affecting most of these inflammatory diseases. I want you to think about this. Inflammation, and there's a concept called inflammatory burden. When you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer. The list goes on and on and on.
The total area of your gums is about the size of the palm of your hand. If you looked at the palm of your hand and you saw an open wound the size of the palm of your hand, would you just decide not to do anything about it? And yet people are choosing every day not to address the infection in their mouths. People think that it's normal that when they brush their teeth, their gums bleed.
With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
In 1996, a study was published and provided the first evidence that women with periodontitis has a tendency to deliver premature and low birth weight babies. So since then, there have been a lot of epidemiological studies to link periodontal disease with adverse pregnancy outcome. Even these mild periodontal infections, when it occurs in combination with some other secondary infection, could cause severe adverse outcomes. And for periodontal disease, it tends to be ignored because it doesn't kill. But I think what we're showing here is periodontal disease does kill, because if the bacteria gets into the blood circulation and gets to the uterus, it could kill the baby.
Here is a patient that's been pretty healthy and doing well and has some growth in the mouth, and typically by the time it is recognized as an advanced stage. She already presented with what's called a stage 4 disease, meaning that the tumor had grown substantially, not only in size, but also had metastasized or gone to the lymph nodes in her neck.
Nobody caught it in the beginning, so if it was caught originally, it might have never turned to stage 4.
A recent study by United Concordia, the largest of its kind, looked at the health of over 1.7 million people and found that almost 200,000 had both chronic conditions and gum disease. Then they looked at those within that group who were treated for their gum disease and those who weren't. The financial savings annually by those treated were impressive. Diabetic patients treated for their periodontal disease, $3,291. Patients with heart disease treated for their periodontal disease, $2,956. Stroke patients treated for their periodontal disease saved $1,029. Patients with rheumatoid arthritis treated for their periodontal disease, $3,964. And pregnant patients treated for their periodontal disease saved on average $2,430. All this simply by getting a healthier mouth. The public, government, insurance, caregivers, and even dentists themselves have to begin to think of dentistry as part of the first line of defense against disease and sickness. The distinction between the standard dentist and a complete health dentist is extremely important. The standard dentist does a good job of taking care of teeth and the mouth, but a complete health dentist focuses not only on care of teeth and the mouth, but also cares for the complete health of the individual.
The Arizona School of Dentistry and Oral Health is very unique. One of our mantras here is that it's not about the tooth, it's about the person attached to the tooth, the family attached to the person, and ultimately the community attached to the family. We want to produce doctors that are leaders in communities and along the way teach them to be great doctors that are engaged with that community.
One of the keys in everyone getting healthy is decreasing inflammation. And the most powerful thing we know about decreasing inflammation is taking care of your gums. And dentistry has a key role in that.